Hello, my name is Danielle and I'm the PA or physician assistant at Caring Medical, and I just wanted to talk about a few of the most common ankle conditions that we see in the office and ways that you at home would know that you're actually a good prolotherapy candidate for your ankle pain. So I'm going to start. I have this young athlete here, and I'm going to start just by going through like I said, common things with the ankle. One of the most probably frequent conditions that we see is the typical ankle sprain. Most commonly in a runner or basketball player or athlete, the ankle actually rolls in when they sprain. So they might be running and their ankle kind of turns in, and that's when they fall. On the outside or lateral side of the ankle here, you actually have quite a bit of ligament tissue. So for those of you unfamiliar, the ligaments are what hold all our bones together in our body. And so when you kind of do this and put a lot of pressure on there, you can actually either lengthen or even tear that ligament tissue. So when someone sprains their ankle, instantly it's going to swell, it's probably going to be really painful, and they're going to hobble on it. Traditional medicine, tells them to rest it, to ice it, take anti-inflammatories, and it'll get better. Well, a lot of the times it just doesn't. It doesn't get better. They're left with chronic ankle pain. It'll swell every time they keep running, and later in life really accelerate the arthritis process. Here at Caring Medical, we do prolotherapy to actually strengthen all those injured ligaments. So like I said, you have a lot of ligament tissue that kind of comes this way. So what we would do is give you shots. Actually, prolotherapy is an injection technique that's used to regenerate tissue. So we would do injections all along where those ligaments attach to the bone to help strengthen them, repair any little tears or sprains that might be there to create more strength in those ligaments and more stability, so that when you continue running or playing basketball or doing whatever sport, your ankle isn't chronically going like this due to loose ligaments, but it's stable, you have good range of motion, and it doesn't hurt. A lot of times, if you sprain your ankle and you really don't do anything about it and you keep walking on it, you actually develop something called joint instability. The reason why is ligament tissue is white. It doesn't have a great blood supply, so it doesn't heal well. So if you're left with these chronically injured ligaments, the joint just stays unstable. Like I said, ligaments hold bone to bone, so if they don't do that well, the bones shift a little bit more than they should. In the ankle, if you're walking and your bones are kind of shifting more than they should, this is a dramatization, it's going to cause a lot of wear and tear on the structures inside, like the cartilage, all the tendon and ligament attachments, and then even the bone. It also, too, if you have joint instability in your ankle, you might get a lot of cracking, a lot of popping, those kind of sounds when you do activity. So like I said, with prolotherapy, we would just inject all along the ligament attachments, even inside the ankle joint itself, to stimulate healing and repair of that tissue, again, creating more stability in the joint, allowing patients to get back to training, get back to their full workout schedule, and be pain-free. Avid runners, marathon runners come in complaining of Achilles pain. They've done a lot of years of heavy training, maybe not worn the best shoes, and they have Achilles pain. So for those of you that you don't know, your Achilles tendon comes back here and attaches on your heel, and it really helps allow you with range of motion and helps you walk and run and do all our daily activities. Typically, when someone has Achilles tendon pain, they're going to be tender right down here where it inserts onto the heel and then all through here. When someone has an initial injury, their Achilles tendon gets a little inflamed. That's called tendinitis, which we've all heard. If they keep running on it, maybe take anti-inflammatories and don't get at the root cause of the problem or treat their injury appropriately, the tendon can actually start to degenerate. This is called tendinosis. So, a degenerated tendon needs what? Regeneration. Prolotherapy is actually going to help regenerate that tendon and regenerate cells to further strengthen it, repair the injury, and get it back to normal, get people back to running and walking and so forth. Very similarly, on the bottom of the foot, if you see here, people with something called plantar fasciitis might be tender kind of right here at the base of their heel. If she actually had plantar fasciitis, she'd probably be kind of screaming or squinting right now. Same thing actually kind of applies as in with the Achilles tendon. They have some injury to the bottom of their foot, they injure that tendon, and they get something called a plantar fasciitis. When not taken care of appropriately, or you take NSAIDs or you rest it, that tendon again will start to degenerate, and the fascia will start to degenerate as well. That's called plantar fasciosis, the osis meaning degeneration. Once again, prolotherapy to that area, right into this spot here, at the heel attachment will help to regenerate that tissue, get people pain-free, and be able to walk, simply walk, live their life, get back to training, or whatever it may be. Another common ankle diagnosis that we see is arthritis. Now, sometimes patients have already had x-rays, their doctor has told them they have arthritis, maybe they've gotten a cortisone shot and they come in to us, or they've never had that diagnosis before, they just have ankle pain, again, they come see us. So once again, if you look here, the ankle, this is full range of motion in our ankle. We should even be able to invert it and evert it a little bit. Those with arthritis might not have full range of motion. They might only be able to go a little bit, not really be able to, kind of move it around like this, and that's painful. What happens is, like I said before, we have all these ligaments that surround our ankle, lots and lots of ligament tissue in the ankle and the foot. When one of those is injured, whether you sprain it or you fall or any kind of injury, again, those ligaments get loose, they don't heal well, and the bones can move a little bit more than they should. That causes a lot of wear and tear, again, on the cartilage, bone, surrounding tissue, all that, it really develops arthritis. If you don't treat the ligament and get at the root cause of the problem, it's only going to continue to get worse. This is where prolotherapy comes in, because we're going to stimulate healing of all those ligaments, get them to be strong, hold those bones back, together like they should, further decreasing the wear and tear on the cartilage and actually helping to stimulate cartilage regeneration. Quite a bit, we do also see patients that come in with bunions. Often they've actually already had bunion surgery, even as early as their teenage years, because it's so painful and there's no other way to get it to go away, according to traditional medicine. Here, we actually, again, are going to get at the root cause of the problem and treat the ligament. So if you look here on this patient's foot, bunions typically develop here, kind of at the base of our big toe, and they can be really painful when you press on it, really painful in shoes, and you might even develop a little bit of extra bone or a big bump in your bone on the inside, again, making it hard to wear normal shoes, very painful. So, patients will come to us. What happens is, again, like I've said, you have lots and lots of ligaments, over 100 ligaments in one foot alone. It's very easy to actually injure them. If you think about it, you might sprain your foot if you're jumping or you fall or whatnot, and these ligaments can get injured. What happens when they're injured? Again, the bones are going to move a little bit more than they should, and your body is going to react to that. One of the long-term sequelae of that is actually bony overgrowth. Your body will start to overgrow bone as a way to compensate for that instability. Hey, these ligaments, they're not healing. If we overgrow enough bone, that joint will stay stable. Yes, it will at the cost of pain. Now you have this, kind of funny looking extra bone growing, and really it just hurts. So what we do is we do shots along the base of the big toe, up here, on the side, and even at the bottom of the toe to get all those teeny tiny ligament attachments, make them strong, and create more stability. We can't necessarily get rid of that extra bone that's there, but we could get you pain-free, able to wear normal shoes, walk pain-free, and get back to training or just living your everyday life. So pain at the base of the big toe is the most common, toe pain that we see, but we do also treat pain in all the other toes. If someone's been diagnosed with a Morgans neuroma or even just arthritis in their toes and foot, we do treat that with prolotherapy and have had successful results as well. So that concludes my talk on ankle and foot and toe related pain. If you think that you would be a good prolotherapy candidate based on your symptoms and diagnoses that you may have received, we'd love to see you. You can contact us directly at info@caringmedical.com or visit our website www.caringmedical.com. Thanks for watching.